Dr. Kiki Molao. For those of you who are first on my channel today, and I hope that you're going to enjoy the content in this channel and that you're here to stay. Please don't forget to leave a subscription, a like button, and also to comment down below on the videos that you want me to create content on. And to my returning subscribers, thank you so much for tuning in again. Your love, your care is well appreciated. Yes, we have grown as a channel from day 0 and now we keep growing even more. Thank you so much for tuning in and continue showing some love to your girl. So in this video, as you can see by the title below, I will be sharing content on cervical cancer, and I'll also be showing you guys what do we do when we actually test for or screen for cervical cancer by the use of a pap smear. As soon as you found this video, or if this video found you, can you please share it with your female friends or any woman in your circle so that they can also be knowledgeable around their health as a woman. You know a say that says knowledge is power. So this video is aiming at that, empowering women to know about their health, to know about what goes on in their body, and if their body is going through changes, what is it that they should be alarmed of, you know. So please do make sure that you share it with your loved ones, your women in the cycle. And if you're a male in this channel and you have encountered this video, or this video has encountered you, please make sure that you also share it with your female friends, your partner, or whoever you know in your cycle that might benefit from this video. I hope you enjoy this video and you learn from it. And if you feel like there's information that I left out, or information that you want me to add on, or maybe a video to add after this video, please let me know on the comment section. Then I'll definitely try my best to answer your questions or make another video following your questions. So let's get into the video. What is cervical cancer? As you can see from this picture that I've attached, we have the vagina, then we have deep in the vagina going in, we have what we call the womb inside. Then the opening of the womb, or the mouth of the womb, or the door to go into the womb, is we made what we call a cervix. So a cervical cancer is cervix, is the cancer of the cervix, meaning cancer of the womb opening, or the womb mouth, or the womb entry, or the door. Sorry, excuse me. Whichever way you want to make sense of it, but just know that it's a cancer around that area. This cancer can progress from that area and it can spread to other areas in the body. As you can see from this picture, the cervix, you have the vagina, then you have your cervix, then inside your cervix you have your womb, then your womb has ovaries, then ovaries outside the womb. Now we get to what? The abdomen. So in the abdomen we have what we call, like you have your bladder, you have all these things in your abdomen. So the cervical cancer can spread from that opening, and if it's progressive or extensive, it can even go to a point where it affects your bladder, which is in your abdomen. So now we got a sense of what cervical cancer. So what causes it, you might ask, ne? So according to multiple global studies, cervical cancer is associated with a sexually transmitted infection or virus that is known as the human papilloma virus, or HPV. And normally the strains that are involved is 16 and 18. 90 to 99% of the time, when they take out the cervical DNA, they found this HPV virus. So that's the most commonest cause. There are other sexually transmitted infections that actually add into the cause of cervical cancer, but 90 to 99% of the time it's found to be HPV virus. Let's get to the risk factors, right? As we have mentioned that it is related or associated with HPV virus, which is sexually transmitted. So risk factor will be sex intercourse, right? So it is said that when you have sexual intercourse younger than the age of 15, you're at a higher risk of developing cervical cancer compared to someone who starts having sexual intercourse in a later stage. This is because throughout our lifestyle, our life, the cervix cells, they, how can I put it, they progress or they mature with age, right? So throughout that stage of maturity, and you are young, you are at the point where those cells are very fragile and more susceptible to infections. So when you have sexual intercourse and also encounter an STI or HPV at that at an early age, whereby your cervical cells are still fragile, they then change form, or the STIs, they affect the transformation or the progression of those cells. That's why it makes you at a higher risk of developing cervical cancer if you are sexually active at a younger age, compared to someone who is an adult who is older. Already those cells that are already developing, they are more in a mature stage, not mature but progressing to a mature state compared at the young. So the chances of them developing or being susceptible to STIs is very low. Sexually transmitted infections. This goes with having multiple partners. This goes with having sex without a condom. This goes to having a high-risk partner. You as a woman can be loyal and faithful and keep it to one partner, but if your partner is a high risk, that also gives you, put you at the risk of developing cervical cancer. The other one is smoking. So it has been studied that tobacco or nicotine products, they actually have chemicals that affect the DNA of the cervix. So when the DNA of the cervix is affected, puts the cervix cells at risk of actually having those HPV infection and later cervical cancer. So that's those are the most common risk factors. And then now let's move to the prevention part. Okay, let's say now you're already facing these risk factors, you're already practicing them, right? Now you know that if you're practicing them, you're at the risk of developing cervical cancer. STI is the best way to prevent it. Stick to one partner, don't have multiple partners. Also use condom or barrier methods. The other one, if you're smoking, just make sure that you cease smoking, or if you haven't started smoking, don't think of smoking. And then the other risk factor I forgot to mention is HIV infected patients. HIV infected patients, they are also at the risk of developing cervical cancer compared to the global population, mainly because when you're HIV positive, your immune system is lower than the other general population. So your body and your cells in your cervix, they are susceptible to developing cancer. So for those who are HIV positive, to help prevent developing cervical cancer is to make sure that you take your medication as prescribed, and you make sure to have a goal for having a lower detectable virus, which you call the viral load. So if you are younger than 15 years old, make sure that you abstain from sexual intercourse or sexual related interventions. So now coming to secondary prevention of cervical cancer, we get to pap smear screening. Pap smear screening is a mode of prevention because it helps to detect whether or not you have cervical cancer. Guys, sorry about the noise if you're hearing the background noise. I'm currently in clinic, so we have people outside this room, so I'm really sorry if you're hearing noises. So as I was saying, we want people to have pap smear or to get pap smear. Firstly, if you're HIV positive, we would want you to have your pap smear at least twice a year of your first diagnosis. And then from there, if your pap smears, they come out normal, 2 of them, they come out normal, then you can have it yearly. And then as you go on, you will get advice from your medical provider. And for the general population, it is advised, general population, people without HIV, we advise that at least you should get 3 pap smears in your lifetime, should they all be normal. The first pap smear that you should get is as soon as you can, when you know that you are sexually active. From that pap smear, if the result come out normal, you can repeat the next pap smear in 5 to 10 years. I'm sorry, from 3 to 5 years, and then from then, if it's also normal, you can progress like that. So normally 2 results, I'll just focus mainly summarizing 2 results that normally come out. They'll either tell you it's a low grade or a high grade. So if it's a low grade, they will say it's atypical, so meaning that in your cervix you have cells that have a potential of being cancerous, so we call them pre-cancer cells. In some people, those cells, they progress and they become normal and nothing happens. In other people, those cells that are precancerous, they then progress to being a cancer, and they can become even more severe, you understand. A high grade, it means those cells you already have a higher risk of having cancer, and then those people, they are normally sent for a secondary testing. The minute you do a pap smear and they tell you that your results are not normal, don't take it lightly, don't overlook it, don't think that no, it's not going to happen to you, you are different, you are strong. Please follow as told by your medical provider. If your cells are abnormal and they give you a date for a repeat pap smear, please make sure that you do follow up with that date to repeat your pap smear and see if the results are normal or abnormal. And if they're still abnormal, they will send you for another test, which we call the colposcopy, where we take a small tissue from your cervix to send for testing to check thoroughly if you do have cancerous cells. How do I know, or how can I be alarmed that I might be having cervical cancer? You can have what we call like a watery discharge. You can have discharge that is also dark brown to red discharge, and it can be foul smelling also. And you can also have what we call post-ictal bleeding, where you bleed vaginally post-sex. You can also get irregular menstruation or irregular periods. You can get back pains, you can get pains around your pelvis, and yeah, those are the most commonest. You can have experiencing weight loss that is unknown. You're not on a diet, you're not doing anything, but you're just constantly losing weight. You don't know why. And other symptoms that can be found is when you are tired most of the time, and when you can't hold your urine, you know, it's one of those things that you can experience. So just be aware of these. If you're experiencing these, just go to your clinic or to your medical doctor and do your pap smear. So yes, now the question is it treatable? You know, is it treatable? Can I live a normal life? Can I go back to normal? The thing with cervical cancer is that it depends on the stage, you know. Remember the video I told you that the cancer can be from the cervix, so then it ascends to your abdomen, can go to your abdomen. So the thing is, with different stages, there is different treatment for everyone. And treatment is not the same as everyone. It's not a one-way formula. You have to sit down with your medical provider and to weigh options that will benefit you as an individual, and then and see what works for you. You know, just because you and your friend were diagnosed with the same cancer at the same time doesn't mean that you undergo the same treatment. She might be having a different perspective, different needs in life, and you might also be having different perception, different needs, and your treatments will be different. But the treatments that are there for cervical cancer, we have what we call a hysterectomy. It's what we it's when we remove the when we remove the uterus of a woman. From there, we can have what we call chemical chemotherapy, or what we call medical chemo. Is normally when we give you tablets or pills or medication, be it with a drip, or you give you medication to help kill those cells that are actually developing. And the other one is radiotherapy, and that is when now we use radiation. The same concept of an x-ray, we use more severe radiation. Maybe say there's maybe a harsher radiation to where the cancer is, and then to actually help burn or kill those cancerous cells. So that's all on treatment. Treatment is different for everyone, and yeah, but the most common treatments are those that I've mentioned. I'm not gonna go into details about them because I'm not gonna cover in this video. The video will be long. Thank you guys so much for tuning and watching this video, and I will try to upload a video on STIs, a short video on STIs, and then I'll also try to upload a video on breast cancer, and yeah, so that you can be well informed, and other medical related diseases. Yes. So guys, this is our pap smear instrument. So I'll attach a picture so that you can have an idea. So once we have instrumentalized and put our instrument through this the vagina to see the cervix, we will brush. It's a brush. See, a brush. Okay, my phone doesn't want to focus. Okay, now it's focusing. So it's a brush like this. So we'll brush through your cervix, and then when we are done with brushing, we will immerse this in there. So this container has liquid, so we'll immerse it in here for a certain period, and then after that we will remove it and send this for test. This is how the sexual kit is. So what we do is, so we would have we use this in the vagina, through the vagina. Right. So what happens is we'll put you in a bed such as this, right, and we would make you to sit in a lithotomy position. I'll just attach a picture so that you can see what a lithotomy position is. When you're in that position, or the position that normally is kept when giving birth, we'll put you in that position. Make sure that you are calm. We will put this through your vagina. We'll put this through your vagina. So the trick with this, the more you relax, the more quickly it goes in. So when you pinch on it, you don't relax, it will become painful. So if you relax, it advances. This is an adult one. After we have advanced through your vagina, I'll show you what we'll be looking at now. Then when we get inside, we will open it to see through this round hole, this hole, what we want to examine, right? What we want to examine. If we're doing a pap smear, we want to see a cervix right there, or if we are doing a sexual assault evidence collection, we want to also see the cervix within that window, right? I'll show you now what the cervix looks like, or what we should look at. So sometimes your cervix can be normal, sometimes cannot be normal, sometimes could be found bleeding or with discharge. Like, it will depend what we see, and we note everything that we see, and we will swap around the area. So what happens is, I'll try to also attach the picture now. So with this brush, we will go through that, and where we see the cervix, we will brush through. When we're done with brushing through at least 6 to 10 cycles, then we will immerse it there as we have mentioned. And when we're done, we remove it. Then the procedure is done. They also use this for intrauterine device contraception, or what you know as a loop, to actually advance the loop through the cervix. So now I hope you are aware of what we do. So that's basically it, guys.